Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper left 4, 5, and 6. On the 3D rendering, we will try to observe cracks, PDL widening. Th- this is the coronal view of the upper left 4. This is a distally rotated premolar. We will observe for any cracks. We don't see any major cracks other than this segment extending from the buccal cusp all the way to the nerve. We don't see J-shaped radiolucency. We don't see periapical radiolucency, and we don't see any significant bone loss around the tooth. But we do, however, see a crack extending from here. This needs clinical correlation for symptoms such as bite test and sensitivity. But other than this particular crack, we don't see a vertical root fracture, so no VF can be seen. This is the upper left 5. This is a single canal. It starts as a wide canal with 2 pulp horns and joins to form one single canal. On this tooth, we don't see any PDL widening, no periapical radiolucencies, and we don't see any major pathologies or cracks present in this tooth. On the upper left 6, we can see we've got 2 canals, the MB1 and the MB2. We see a little bit of PDL widening here, but we don't see a radiolucency. We don't see any cracks. We don't see any cracks extending. We have a pulp stone situation where we've got a radiopacity between the floor and the roof. This is the palatal. The palatal shows PDL widening as well. The interradicular area seems to be uneventful. We don't see any cracks propagating or furcation involvement. And as we move to the distal root, we see a single canal in the distal. So, and taking you to the the axial view. On the axial view, you can very clearly see 2 canals in the 4, 1 in the 5, and then here you can see MB1, MB2, distobuccal and palatal. Again, no cracks can be observed on this view other than when we see, like mentioned, a crack in the 4 towards the, that's the only crack we see right there. This is the same one we mentioned on the buccal aspect, close to the pulp horn and extending into the nervous space. But other than this particular crack, we don't see any major cracks present in the tooth. So 4 is the only one we're suspecting any problems with, a little bit of PDL widening, but no cavities can be seen in the, and this is where the pulp stone or opacity is present in the upper left 6. Thank you very much.